If you are trying to conceive, move forward. This video is for you. Today, I will be telling you some reasons why you are not pregnant today. So, without wasting so much time, let's get into it. Hello guys, welcome back to my YouTube channel. If this is your first time coming across my video, please consider subscribing. On this channel, I talk about everything fertility, how I was able to navigate infertility, and I was blessed with two beautiful kids. Using my real life scenario, I will be telling you some ways that you will be able to defeat infertility and get your own blessings. If this resonates with you, please click on the subscription button, hit on the notification button so that when next I drop my video, you will be the first to know. We also talk about motherhood and parenting in general. So, if you are trying to navigate motherhood, if you are a parent and you love everything parenting, please subscribe to this channel. This channel is for you. So guys, let's jump into today's video. I've tried to ask myself, why are some of us struggling with fertility? You don't know, but it varies. It's different things could cause it. So I went on and do some research, and today I will be sharing with you some of the reasons why you are not pregnant. So let's get right into it. Number one, ovulation issue. That one is number one. If you are not ovulating, forget it. You are not going, you will try and try. Some people will go and meet the pastor and they will say, oh, let me pray for you. Trust me, nothing is going to make you get pregnant if you are not ovulating. A different thing could cause uh make you not to ovulate. It could be a PCOS issue, which is what affected me. But thank God I was able to fight it and I was blessed with twins, two beautiful girls. So if you are trying to conceive, don't just go see anybody. See the right people, like what I usually say. See the right people, do the necessary test running. When you are diagnosed, then you will know what is wrong with you, and then you will be able to fight infertility and you will be blessed with your child. So PCOS could be a reason why you are not ovulating. Thyroid disorder could be a reason why you are not ovulating. Another reason why you are not ovulating could still be prolactin issue. Is another thing that affected me too. So that could be a reason why you are not ovulating. So hormonal disorder could still be a reason why you are not ovulating. Which is where prolactin come in. If your hormone is if one of your hormone is too high, it could make you not ovulate. So it is good you see the right people, do the necessary test and know what is wrong with you and fight infertility. So another reason why you are not pregnant, another reason that could be the reason why you are not pregnant is fallopian tube blockage or damage. If your fallopian tube is blocked or is damaged, you can never get pregnant. You can never get pregnant. Go and meet a herbalist, go and meet native doctor, go and meet any pastor. You will never get pregnant until you fight it. God has put the doctors there so that they will help us in times like this. They are not just there. All these helps that were created by God, it is created there to help us. And these doctors, they have studied, they have do a good research and study about human to for them to be able to help us at a point like this. So if you are going through a time like this, go and meet your doctor. While you are praying at home, still be seeing your doctor, so that you will know what is wrong and be able to fight it. Okay, so let's continue. So what causes fallopian tube blockage? It could be past infection issue. Maybe you have pelvic inflammatory disease, it could cause it. Another one is endometriosis, could actually cause this. It could cause it as well. Then previous surgeries affecting the tubes. Maybe you did a surgery before at your pelvic area and it affected your fallopian tube, so it could cause it as well. So if you do a surgery like that and you don't know if it affected it, I will advise, and you are trying to conceive, you've not gotten any you've not gotten results, I will advise you see your doctor. Let let them check it and see if that surgery actually affected it, or you are still fine. So it could still be other reasons as well. Okay, so guys, if you think of anything, please leave your comments, leave something in the comment section, tell us your thoughts in the comment section. So another reason, number three reason why you are not conceiving, it could be uterine or cervical issue, that is fibroid or polyps that affect implantation, or abnormal shapes of the uterus. So all these things dey causes infertility. So another thing there that is still very crucial that we even do not really talk about is male factor infertility. It is not only women um that could have a problem. That is why I always advise, if you are going through infertility, always go with your husband. Let your spouse always follow you. If your husband is not following you, it is wrong. You are not doing anything. Even though you were diagnosed of a problem or of an issue, your doctor is trying, still yet you are not getting any issue from it. Then you your husband could still go to the hospital, let them check him and know if there is still something that him too need to treat. If you remember when I was telling my story, I told you that at a time when we checked before and we found out that my husband was good, the sperm was okay. When we later went back to the hospital, the sperm reduced a little bit, and doctor said that we should still boost it. So he was taking his own supplements to boost his own sperm motility or something. So it is always good to go with your spouse. Don't just go to the hospital alone. Drag your spouse along. Tell them to come with you. If you are gaining knowledge from this channel, please leave a comment in the comment section and tell us your thoughts, what you think about it. What do you think about spouse going to the hospital with their partner, and when during a time like this? Tell us your thoughts and let us know what you think about that. So low sperm count, poor motility and abnormal shape of the sperm could cause infertility for men. If your sperm is low, you can never get a woman pregnant. If your motility is low, if your motility is poor, you can never get a woman pregnant. Not in this life, not in the next. So therefore, if you don't text for this thing, you will never know. You may think that you are good because this thing, they don't affect you, they don't affect your body, your performance um in other activity, in life activity. So you will still be doing good, you can do your normal daily activities, and that place there is a problem there. When you think that you are perfect, you just may not be perfect. So it's good you go to the hospital with your wife and know what is wrong, then you can fight it together. So another thing again that could cause main factor infertility is erectile dysfunction or ejaculation issue. If you are not having erection, of course there's no way you can even perform in the first place. So how are you going to get a woman pregnant? So hormonal imbalance can also cause it too. If the man's hormone is not okay as well, he too cannot get a woman pregnant. He's having a infertility issue too. So it is good you go and test yourself and know what it is. Number 5 is age related factor. This is another one. So for female, once you are 35 years old and above, doctors always advise that you try for 6 months, and once you are 6 months trying yet you've not gotten pregnant, you should go straight to the hospital and see a doctor. But to me, I will even say you should not try more than 3 months. Just once you try for 3 months and you are not pregnant, go and see the doctor. It will not cost you too much to see the doctor, run your tests and know if you are fine. If you are fine, then you go back and continue trying. If you are not fine, then you deal with the problem immediately instead of waiting for so long, and then you run into depression and all of that before you see the doctor. I would advise you go see the doctor. And this thing too still affect men too as well, once they are going to one certain age. But we know that men always have a longer lifespan than women. So once women are 35, their risk of getting pregnant depreciates year by year. So but for men they have a little more time. But if I think if you are still 35 as well as a man, and 35 or 40 or 45, you should know that your sperm level, your sperm count is depreciating too as well. So that is it. Age related factor. Once you are growing old, your your fertility depreciates with you. So another thing there is lifestyle factor. Lifestyle factor. If you are trying to conceive and you are smoking, you are taking hard drugs, you are taking um alcohol, excessive alcohol, it's not good. Even caffeine as well, doctor will always advise you to reduce it to a good extent, or even stop it totally. So that is what you should do. You cannot be looking for something like that and you just be careless. That is what some people do. So you stop excessive alcohol if you are doing that. Stop taking hard drugs if you are doing that, and also stop smoking. Smoking is not good for you if you are trying to conceive, and even when you have conceived, it is still not good for you. So reduce it. And for it, this is for both male and female. It's not just for the female alone. Some people will say I can still get woman pregnant even though I'm smoking. No, stop it when you gotten your wife pregnant, or when your wife is pregnant. You can go ahead and keep smoking, whatever. And yeah, that's it. So number 7 is medical condition. Diabetes. When you have maybe one serious illness, it could still cause infertility, like diabetes, um chronic illness. Just some chronic illness could cause it, or genetic disorder could also do what? It could also affect fertility as well. So guys, if you are getting something from this, please tell me what you learned from this channel, from this um video. Tell me what you're learning, and leave a like, and also share to those that you know that are trying to conceive. So because one of these things could be the reason why you are not conceiving. So the last one there is unexplained infertility. there is something like that as well, because I mentioned that in my last video on my IUI experience. If you have not watched it, by the way, please go back and watch those videos. So unexplained infertility is basically um you've run the necessary tests, you, your husband have run the tests, and yeah, you look, everything look good, you look good, your husband is good, but then you are trying, but no success, no, maybe you've tried for 1 year, but yet nothing. And you've run tests, you've done your hormone test, you've done your HSG test, you've done all the necessary tests, your husband sperm test has been run as well, everything, and everything looks good, but then you are trying and yet you are not pregnant. So all these things could cause it as well. So once you have um um something like this, see your doctor, keep seeing your doctor. They will give you the necessary supplements that will help you to get your 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 pregnancy or your baby that you are looking for. So I will advise that you see your doctor, and then talk to your doctor, and be patient as well. Some of us are not patient. Some of us, we are good at jumping from one doctor to the other, jumping from one person to the other. When we've spent some time with this doctor and we are not getting it, we just be like, oh, except the person you are seeing is not a specialist. If the person is not a specialist, then you can move to a better doctor, to a specialist that you know that this is what he was taught to do, this is what he was trained to do, this is what he has been doing for some time. So that is what you should do. So guys, if you gain something from this video, please tell us in the comment section and leave a like. Share this video to your loved ones, share to people that are trying to conceive, and remain blessed. See you in my next video. Bye.